Hello guys, how are you? Welcome back. Today my topic is regarding vaccination. Let's talk about vaccination. What is vaccination? Vaccination is when a vaccine is administered to you, usually by injection. We can administer vaccine by different routes like oral routes, subcutaneous route and intramuscular route. Oral route means administered by mouth. Examples of vaccine which we give by oral route are, first example is like monovalent attenuated human rotavirus vaccine, also called Rotarix, and second example is pentavalent bovine human rotavirus vaccine, also called Rotatec. Next is subcutaneous route. Subcutaneous route means here we have to inject the vaccine into the area just beneath the skin above the muscle into the fatty connective tissue. Examples of vaccines which we give by subcutaneous route are MMRV vaccines, means it's a combination vaccines of measles, mumps, rubella and varicella. Now last route is intramuscular route. Actually in this case the vaccine is injected into the muscle mass. Examples of vaccine which we give by intramuscular route are DTaP, IPV, Hep B vaccine. Means DTaP means diphtheria, tetanus, acellular pertussis, IPV means inactivated poliovirus, and Hep B means hepatitis B virus vaccine. It's a combination of these vaccine. So one thing you must keep in mind that vaccines should be given by intramuscular injection in preference to subcutaneous injection. Why? Because intramuscular route is associated with better immune response and a lower rate of injection site reaction. So next term is like immunization. What is immunization? Immunization is what happens in your body after you have the vaccination. So what the vaccine exactly do? The vaccine stimulates your immune system. It stimulates your immune system so that it can recognize the disease and protect you from future infection. That is you become immune to the infection. And now let's talk about the coronavirus vaccination. Vaccines of coronavirus are also designed to activate the immune system in the same way, but without making us sick. Mild to moderate vaccine side effects are normal. Let's make it simple. That vaccines work by introducing a small number of bacteria, virus or toxin into your body. Because bacteria, virus or toxin has been killed or weakened, there is no risk of disease. In response to that, our body producing T lymphocyte, also called memory cell, B lymphocyte cells and antibodies that will remain in our body. If in case actual virus will enter, we will have an army of cells and antibodies ready to fight it. Sometimes after vaccination, the process of building immunity can cause symptoms, or we can say minor side effects. What are these minor side effects? Like a pain or swelling at the site of injection, fatigue, tiredness, headache, fever, nausea, myalgia means muscle pain, chills, lymphadenopathy means swollen lymph nodes, joint pains, redness. These symptoms are normal and usually last a few days and go away on their own. And these symptoms are a sign that the body immune system and vaccine is working. Nowadays people, they keep on asking questions regarding corona vaccination, like can I still get COVID if I get the vaccine? The answer is yes. None of the COVID-19 vaccines provide 100% protection. So there is still a chance you could get COVID even after you get both the doses. So next question they usually ask, does the vaccine prevent COVID? Answer is the current vaccines are highly effective at preventing people from getting seriously sick with COVID-19. So another question they ask is the COVID vaccine FDA approved? The answer is currently the US Food and Drug Administration has authorized and recommended 3 COVID-19 vaccines for emergency use. Who are these 3 COVID-19 vaccines? First is Pfizer BioNTech COVID-19 vaccine. Second is Moderna COVID-19 vaccine. And third is Johnson COVID-19 vaccine, of Johnson & Johnson company. So, but the vaccines which are of highest efficacy, about 95%, are the first two. Means Pfizer BioNTech COVID-19 vaccines and Moderna COVID-19 vaccines, they give the highest efficacy, about 95%. And about Johnson COVID-19 vaccine, it gives the lower efficacy, about 60 to 70%. Apart from Johnson COVID-19 vaccine, two other vaccines are also there, like AstraZeneca COVID-19 vaccine and Novavax COVID-19 vaccine. It also gives the lower efficacy, about 60 to 70%. Another question people ask, that how often will we need to get the COVID vaccine? The answer of that question is the number of doses needed depends on which vaccine you receive. To get the most protection, you need to use the two vaccines, Pfizer BioNTech vaccine and the Moderna vaccine. But how much dose you have to take? In case of Pfizer BioNTech vaccine, two Pfizer BioNTech vaccine doses should be given 3 weeks apart, means 21 days apart. And the second dose of Pfizer BioNTech vaccine can be given up to 6 weeks after the first dose if needed. And in case of Moderna vaccine, two Moderna vaccine doses should be given 1 month apart, means 28 days apart. Next question is which vaccine is best for COVID? Then the answer is simple, that Pfizer BioNTech COVID-19 vaccine is 95% effective in preventing the COVID-19 virus with symptoms. This vaccine is for people age 16 and older, so it is best. Next question, usually people ask that what is the COVID-19 RAT test used for? Means rapid antigen test used for. Actually, the rapid antigen tests are commonly used in the diagnosis of respiratory illnesses. In this case, the rapid antigen detection test looks for proteins produced by the SARS-CoV-2 virus, which is the virus that caused the disease called COVID-19. And what about the RT-PCR, reverse transcription polymerase chain reaction? This test, it takes 72 hours, 3 days after taking the sample to declare the test report. So even the people ask about, is there any chances of serious side effects? The answer is very rare. 1 to 2 cases per million vaccinations, I can say. I'll give you the example of yellow fever. It is also caused by other virus. In case of yellow fever, the rate of serious side effect is 0.09 to 0.4 cases per 10,000 doses of yellow fever vaccine. In case of measles virus, death rate is 1 in 500. And in UK alone, every winter, one virus is responsible for almost 200 deaths per season, that is flu virus. So I just want to say that there is a remote chance that COVID-19 vaccine can cause serious allergic reactions like difficulty breathing, tachycardia, increased heartbeat, face and throat swelling, skin rash, dizziness and weakness. So last question, the people ask sometimes that can the COVID vaccine give me COVID-19? No, absolutely not. So one thing you must keep in mind, that World Health Organization has warned that the virus will continue to spread rapidly in the coming months. So many European countries witnesses an increase in cases during the autumn, and many countries implemented lockdown also. Even United Kingdom is also experiencing another steep rise in cases driven by a new, more easily spread mutated variant of the coronavirus. At the end, I just want to say that it is better to wear mask than wearing it on ventilator. It is better to wash hands than washing hands from life. It is better to remain in house than remaining in ICU. So let us follow guidelines strictly to get rid of this killer virus. Take care, stay safe, healthy, happy and blessed. Thank you so much for watching. Thank you.